Welcome to All Things Chiropractic.
Welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
And welcome. I'm Dr. Mark Davini.
I know that everybody's going to stop and just listen to every single word of this podcast because we're talking about, will insurance reimbursement ever improve for chiropractors? Thank you for listening to another episode. I had to go there, man.
The pause, the long pause. So here we are. Let's discuss this.
Adjusting the system.
Ooh.
Boy, does it need adjusting. Listen.
Oh, my God.
So certainly, Dr. Davini, after years and years of practicing Mercedes 80s and all that fun stuff, and myself, a few years of being in chiropractic and billing company and being a CA and all that stuff, we have a lot of opinions here. And this should come with a warning that not all opinions will be positive, but we do need to talk about insurance because.
So where are we? This is a great backdrop here because we all operate under what is defined as a fee-for-service structure. And that has been slowly evolving, and not necessarily in a positive way, so maybe evolving is the wrong word, but changing. And where did it all start? Where did it all come from?
Let's define fee-for-service just for those that may have a mystery of that.
Right.
You're talking about you bill all the service codes that you performed and you get reimbursed by code.
Exactly.
Right? So that's really what we're talking about. It's been the model for a long time, fee-for-service. Now, the model that has come into play over the years, probably more than a few years, is global payment, where you still bill every single code that you do. However, there's a global fee or a maximum amount for that data service. You won't realize any more money. The more code you put on there, doesn't matter. There will be a global maximum. And whenever we talk about maximums or allowables, this is all before the copay comes out or the deductible or the coinsurance. This is the total allowable.
Yeah. So where did this all come from? And dare I say it started back in 2010 when Obamacare came into play. And the goal of Obamacare, as a general rule, is to eliminate the private practice. They wanted to move all healthcare and healthcare practitioners into large groups. And so they want to take these large groups, and by having a large group, they're able to negotiate with that group rates. So back then, we were still on a straight fee-for-service basis, and as time went on, they started bringing in EHR, and then they incentivized us to put in EHR in our offices by giving us money to put in these EHR systems.
Meaningful use money. That was pretty good.
Yeah, it was pretty good.
Pretty good.
Right? Oh, yeah.
The testing was a pain in the butt, but
hard to say no to. So now we have all these systems that are going through this staging. And the last stage is supposed to be interoperability. That means my computer can talk to your computer. Because before, my computer might have talked French and your computer might have talked English, and they can't talk to each other. But now they speak the same language through all of this certification process that they went through. So now we have a bunch of computers that can talk to each other. We have a goal of trying to bring everybody into large groups. And then the last step was ICD-10. Instead of it being symptom-based, it became condition-based. Went from 14,000 codes to 70,000 plus codes. So now they're able to determine what condition is being treated. And now I have a computer that can talk. We have computers that can talk to each other. And eventually, as time goes on, if you've noticed, you might be getting requests for audits and records here and there. One of the options is to let them connect to your computer.
Yeah, as if.
Yeah. And be able to download the records. And now we have this system in place where they want you to be in a large group. They want you to diagnose according to the specific condition. They now have codes that will relate that. They now have a system in place to talk to your office. Right now it's voluntary, but down the road it will become one of those things that you sign off on your contract to say it's required that we get into your system. Once they get into your system, they're now able to analyze treatment for a specific condition because the codes allow for specific conditions now. And they're going to compare. And they're going to compare you to your colleague down the street. They're going to compare you to the other professional who might treat the same conditions and diagnoses. Then they're going to determine, number one, who does it more efficiently and more cheaply than the other. And once we determine what that cost is, we're going to negotiate a global fee for the condition. Right now, we have global fees for the services, but they're going to start negotiating global fees for the condition. So you come in with this certain ICD-10 code that tells me they have a certain condition, and I'll pay you $1,000 to treat it. I don't care how many times you see them. I don't care what you do to them. I'm only going to pay you $1,000. And you go, oh, that might be nice if the rate is right. But let's face it, they're not going to pay you well for this. And it's all automatic. AI will take over. They'll get into your computers. They'll determine how many times you're treating somebody. They'll do the analysis. They'll come up with this per condition fee. And that's where it's going. And this has been a long-term plan. How's that for a conspiracy theory?
Well, you would think it ventures away from our topic of will insurance reimbursement improve, but because it's an insurance reimbursement, you have to talk about all the things that come with being enslaved by insurance companies.
Right. So is it profitable? It'll all depend on what they want to pay you, right?
Or will it get better?
Will it get
But
better?
I can tell you that you probably know that some of this already exists because there are carriers like the Blues, maybe not in all states, but in some states, they send you a provider usage report every year. And they send you your usage. If you're in a group, they'll send you the usage of your associates or peers, but they'll also send you the average usage of your cohort or your specialty in your geographical area.
Yeah, they try and guilt you.
Or they actually try to put fear into you.
Right.
If you look like an outlier, I have one provider, Palmer does x-ray on everybody. Like his opinion is, my medical necessity standard includes x-rays on anybody I'm going to adjust.
Which I agree with.
But from a Blue Cross usage standpoint, especially now where a lot of offices don't even have x-ray, his x-ray usage is off the chart. Is he an outlier? You betcha. You betcha on x-ray because he does it almost 100% of the time.
Yeah. So if Blue Shield wants to start putting out a list of chiropractors that they recommend you see, and they've gone through the whole process that I just described, they're going to recommend the ones that are the cheapest.
Well, that's the whole goal on their end, right?
Right.
So,
not the best.
Yeah. Some of this infrastructure is there, but you're right. AI is going to change the game because this stuff will likely start to become concurrent,
And immediate. It'll happen so quickly you won't even know it's happening.
But they draw you in. Like it's all in the name of convenience and efficiency, right? Those are the two words that are going to be our downfall as society, I think. But anyway, because what'll happen is, right, you'll see a patient with a particular carrier. They'll come in, you'll do the exam, maybe treat, you'll put it in the system. Before they leave that door, you'll get paid. And this is great. However, it also comes with a lot of downsides you just outlined that maybe it won't be worth it. I don't know.
I was riding in to do these recordings today,
Yeah.
and I heard an advertisement for a new app that said, sign on to this app and you will get paid daily for your job. You won't have to wait for payday. We will pay you every day up to $150 a day if you sign on to this
Minus
app.
their fee. Yeah.
For no more than $750 a week. But you, instead of getting paid every 2 weeks or even once a week or whatever, you'll actually receive money in your bank every day based on your job's pay. And like you said, for a fee. So you go, oh, that's convenient. How much can it cost? And they make it probably very inexpensive up front. Right? And you think, oh, this is great. I get my day's pay put into my bank account every day instead of waiting till payday, which means, you think you have money all the time and you don't have enough to pay your bills or whatever at the end of the month because you've spent it every day. But it goes to show that there is this whole progression toward trying to become part of your finances and become something that they control and regulate and get a piece of.
So as we talk about whether insurance reimbursement is going to ever improve for chiropractors, I want to take a step back for a second and talk about the mandated health insurance requirement. Because in Massachusetts, where we are, we're ahead of the nation, right? We had Romney Care that came in before.
3 years first. Yeah, longer.
And my opinion, but also my analysis, is that when mandated health insurance came in and started to, ramp up both in the state and then nationally, the perspective of the perception of the patient in their care changed. Prior to that, it's my belief, and I think data would back me up, is that a patient would come into a chiropractic office and not expect that their insurance would actually cover it. And if it did, it was a nice bonus. And if there was coverage, the copays were pretty low. But if it wasn't covered, they were willing to pay out of pocket for that care. Now, you can add in all the different, factors into that where, back then, oftentimes the chiropractor was the provider of last resort. They had crunched through the system and couldn't get relief. So they're willing to pay anything, right? Patient in pain is willing to pay anything. Beyond that, though, if you fast forward now, the understanding of a patient is that I pay a lot for my insurance. I pay a lot in patient responsibilities, co-pays, co-insurance, deductibles. Therefore, it should cover everything. Everything beyond the copay, basically, or deductible. And even if there's a deductible, the person who's giving you the bad news about your coverage, whether it's high deductible, non-covered services, is usually the chiropractic assistant in the office, right?
Right.
So that's the messenger who gets the brunt of the negativity. It is
that you pay minimum wage to.
Right. So when we look at insurance reimbursement, will it ever improve? I think it will be challenging. We might be able to say, bottom line, yeah, sure, there'll be small incremental increases in allowables. But every time they raise an allowable, which means the total portion of your reimbursement, they're also raising patient responsibilities. So in essence, the allowable might go up by a couple of percentage points, which really translates into pennies.
Mm-hmm.
But the patient responsibility is going up by leaps and bounds. So the cost share is shifted now back to the patient. The patient's feeling the heavy burden, especially in chiropractic, because copays are often exceeding allowables. So now the insurance isn't paying anything. You're just taking a reduction because of your contract fee schedule. The patient's paying the whole boat. And now you're asking them, well, it's going to be, $48 and change every visit. I want to see you 3 times a week. They're calculating $150 a week, right?
Times 6,
that's
8, 10, 12 weeks.
Almost $600 a month for chiropractic. They're like, that's a car payment. Like, whoa, hit the brakes here.
And how did we let this happen? I kind of look at it and you go, when there was a time there was no insurance, our language back then was we were fighting for insurance coverage. We got there. Everybody essentially in Massachusetts has chiropractic coverage in their insurance. But what they don't have is a proper reimbursement, an adequate reimbursement. So when we were fighting back in the day to get insurances to cover chiropractic, we really should have recognized that, and they were resistive. And I think they changed their strategy. They recognize that the way they could put us out of business is to limit the reimbursement. Sure, cover chiropractors. Everything's great. Cover chiropractors. It's perfect. No problem. We love chiropractors. Yeah, we even cover chiropractic. And then they hurt us by giving us such a low reimbursement rate. So now all of a sudden you're in business. You're practicing chiropractic. You submit for insurance, and they're paying you pennies on the dollar.
Yeah, I would say most carriers, their allowables are really anemic when it comes to doing business. And you think you can make it up in volume, but you may not be able to, or it's such a small margin that...
Well, the volume ends up being so great. Where's the compromise in your business? Where's the compromise in your patient care? Where's the compromise? Because to see more means you're doing something else less.
Right. And it's funny because as a massage therapist, I see the massage therapy profession. They are facing what chiropractic did when chiropractic was advocating for insurance reimbursement. Massage therapy now in today's day there are a lot of them that are doing the same thing. They're advocating for insurance coverage. And I keep saying, be careful what you wish for. And I give chiropractic as the example that, most chiropractic offices, if the trend keeps going the way it is, they'll all be cash practices because the allowables will be so low and the patient's copay is so high that the reality is there's a lot of geographical locations where patient copay averages are the same or more than the self-pay rate.
Which circles us back to what you hear as a constant theme through all of our podcasts. It's perceived value. One way or another, with insurance or without insurance, somewhere along the line, you're going to have to ask somebody for money. And their willingness to pay that money comes from perceived value.
Right. So if we're looking at the question at the top, which was, will insurance reimbursement get better? It depends on the figure you're looking at. If you're talking about just strictly allowables, most of the carriers, they've been pretty static, but some of them will increase in a very small way.
But given the increases of cost of living, static means a pay cut.
Yeah, or even a 1.8% fee allowable increase. It still means that they're not keeping ahead of cost of living or inflation. Oh, and by the way, the patient's responsibility went up. So the only one that's absorbing this is either the patient or the provider or both.
Right.
The carrier is the one who's in charge of the game, so they're not going to play to lose in that game.
And remember, you're the one who signed the contract. You knew the rates when you signed the contract.
Well, I'll push back on that. There are actually carriers that will not disclose the rates until after you sign the contract.
Which is a contract you shouldn't sign. But
yes,
correct. There we go. Right there. Bad business right
Or pick
there.
up the phone and ask your buddy down the street who's in contract, what are this allowable? Because I'm not getting into business like this if I don't know.
No. So again, it comes up, will it be profitable, more reimbursement improve over time? The likelihood is no.
If you're looking at the actual practical application of this, the answer really is no, because again, the allowable might go up in small increments, but the patient cost share is much higher. Cost of living doesn't go down. Inflation, it might be better, but it's still going to be there for the most part. And you have to look at yourself. And I guess the point or the moral of the story is try not to rely on insurance reimbursement for your business, because that's a fool's errand, I think.
50% of your business at the most should be insurance. And then after that, you should be moving to something that allows a cash flow, some level of self-pay, whether it be wellness care, whether it be services that are outside a covered service. The covered services, things like decompression, shockwave, these things laser. These are things that people pay for outside of their insurance policies, happily sometimes, most of the time, I should say. So you have to start looking at it as insurance is not the way to profit. Insurance is a necessary evil. It's something we have to use and manipulate to our advantages as best we can. But insurances are not going to be the way you make a living in this profession.
And again, because you're battling a patient perception that insurance should cover everything, it is a bit different than it used to be as far as what it really emphasizes to me that is that your policies, your procedures, your approach, both clinically and from a patient management portion or side of it, not just you, but your staff, you have to be on your A game because these patients, not all of them, but some of them are going to push back and say, well, I can't afford it. Or even if they could afford it, they're just pissed off that they have to pay out of pocket for something when their carrier should be picking up the tab.
And, one of my biggest indicators that this is real, what we're saying is it's also happening to medicine. I went to the dermatologist.
Try not to smile.
I know. I went to the dermatologist a couple months ago. So I go into the visit, and of course they do the regular annual exam type of thing, which to me is an annual, but they went in and did the exam. And they charged $347 for the exam. They got paid $47 for it. So of course there was something that they found that they said, we have to biopsy that. So they take a little piece out of my ear to send to biopsy, which came back negative. Thank you very much.
All right.
But came back negative, and they charged $400 and something for that procedure and got paid $67, I believe, something like that. And then they froze one little spot. Again, charged $200 and something for that, and actually got paid $108 for that. They got paid more for the little nitrogen spray on my arm than they actually did cutting a piece out of my ear. But the point is, there was like a $1,300 bill they charged out, and total collected $220. Now, here's the kicker that goes back to the way back in the beginning of the podcast. When you build a facility, if it's a hospital, they get to build a facility for the same exact services.
Yeah.
So they actually might seem like they're getting cut back, but the provider gets cut back, but the hospital makes the money. And we're not hospitals. Yeah. That's why they want to get us into a large group so that the large groups can bill for the facility fee along with the provider fees. And the providers will get shortcut just like we did, or we do, and the facility will be paid and continue to make money.
It may sound like, well, if I'm an ACO or something like that, right? That, we'll have better negotiation power because we can leverage as a bigger group. The problem is you're not just a chiropractic ACO. You're in with other specialties. And I can tell you, like, my wife's an occupational therapist and she works for a school system and she's part of the union, and the union does their negotiations every 3 years. But who's the union really negotiating for? It's the teachers. Those are the bulk of their membership.
Right.
Right?
They're bread and butter.
Right.
Yeah.
So a lot of times you're looking at this contract and my wife's like, well, a lot of this is just teacher stuff. It doesn't make any sense. Yeah. It doesn't work for us in a sense. We're basically a round peg in a square hole. Or a square peg in a round hole. Is that how you say it?
That's it. Square peg in a round, doesn't matter. They don't fit.
Yeah.
I'll come more to a closing with one last little story to give you an idea that we are not part of the system that's evolving. I had a friend that was getting dizzy, and she was elderly. So you go to a neurologist. The neurologist does their neuro exam and says, well, I don't find anything, but I am going to send you to a neurocardiologist just in case. So she goes to the neurocardiologist, and the neurocardiologist says, well, I'm electrical. I didn't find anything, but you need to see a plumbing, heart, basically the plumbing of the heart. Goes to that neuro person. Nobody. I think maybe just in case, let's get you to a neuro-ophthalmologist in case your eyes aren't tracking properly and that's making you dizzy. Neuro-ophthalmologist, nothing. And then finally, last one, a neurosurgeon, just to make sure there wasn't any cord compression or something like that. So essentially, this person went to 5, quote, neuro-somethings in the hospital. Every one of those neuros were paid a salary. whether they saw one person that day or 100 people that day, they were going to make the same money, essentially. There's bonus systems or whatever, but essentially the same money. But who made the money? The hospital, because they got to bill for 5 different exams where essentially what the last 4 did was no more than what the first one did. So we're not part of that game.
Yeah, it's a system that feeds itself
right
continually, right?
Exactly. So
and they've got their own barriers and their own issues, but the reality is they're dealing with a lot more money than we are.
Right. They get paid a lot more money and they get reimbursed a lot more money. So they're working with a lot more money, where we work with such a narrow margin to answer the original question posed, where we said, will insurance reimbursement ever improve for chiropractors? With all factors considered, not likely.
But I'm a silver lining kind of guy. Take this opportunity where the system is pushing you into cash-based services or self-pay services. Embrace them. Hold on to those. Learn about them. Use them. Find out what you can do that's outside the insurance system so that you're not relying on what comes in that week from the insurance carrier.
And I think that falls perfectly into your quote from Ronald Reagan.
You're the old guy. You can tell.
Oh, God. I remember 1982 State of the Union address. Let us go forward, steady, sure, and confident, and leave behind the tired failures of the past. Don't keep doing what you've been doing. Make a plan and do it differently.
And don't feel bad if something didn't work or you're saying, well, I must be failing because I do rely on insurance. Look forward. Don't look back, because you can be that success. You can make yourself outside the system that you might be playing in right now. And at the end of the day, it's going to be way better for your patients, in my opinion.
You'll be happy. They'll be happy.
With that, thank you again for another episode of All Things Chiropractic. I'm Paul Andrews.
Dr. Mark Davini, thank you.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.